The small intestine meridian begins on the ulnar side of the little fingernail, near where the heart meridian ends, and flows down the arm along the medial dorsal side of the arm to the back of the shoulder. On the shoulder, it takes a zigzag path over the scapula and turns to the side of the face, ending in front of the ear. The inner branch enters the supraclavicular fossa and flows into the heart, stomach, and small intestine. The upper branch enters the ear and reaches the inner canthus, where it connects with bladder 1 of the urinary bladder meridian. SI1 is located on the little finger, point 1 Tsun, from the ulnar corner of the nail. SI1 is the first point and the entry point where the energy from the heart meridian flows into the small intestine. This is the metal point and therefore a sedation point of the meridian. SI2 or small intestine 2 is on the ulnar aspect of the little finger, distal to the metacarpophalangeal joint at the junction of the shaft and the base of the proximal phalanx. SI2 is the water point and grandmother point of the meridian. Increases the small intestine yin when tonified. SI3 is located on the ulnar border of the hand in the depression proximal to the metacarpophalangeal joint at the border of the red and white skin. SI3 is the most important point of the meridian. It is both the tonification point of the small intestine and the confluent point of the Du meridian. It is used to treat all problems of the vertebral column as the Du meridian flows along the vertebral column. It can be either tonified or sedated to influence the Du meridian. SI3 can be used in tonification against postural problems such as kyphosis and in sedation when there is back pain during extension of the spine or the backward movement of the spine. SI4 is on the ulnar border of the hand between the fifth metacarpal bone and the triquetral at the junction of the red and white skin. SI4 is the yuan source point of the meridian, which could be used for sedation of yang, usually together with heart 5, the luo connecting point of the heart. SI5 is on the ulnar aspect of the wrist at the level of the lateral joint space. SI5 is the fire point and the house element point of the meridian. Increases the yang of the small intestine and heart, improves the function, warms the body, and elevates the mood, gives the feeling as if one is sitting near a fire. SI6 is located in the depression, radial and proximal to the styloid process of the ulna. This forms when the hand is turned from a pronated to a supinated position. SI6 is the she-cleft point of the small intestine channel used in acute conditions like enteritis, acute exacerbations of Crohn's disease, and acute appendicitis. SI7 is 5 Chun proximal to the wrist joint on the line connecting the ulnar wrist joint space with the ulnar sulcus of the elbow, SI5 to SI8, or 1 Tsun distal to the midpoint of this line, or just ventral to the ulna. SI7 is the luo connecting point of the small intestine, tonifies its yang and decreases heart yin. SI7 is an excellent pain relief point for backache and sciatica when given in sedation. SI8 is located with the elbow flex in the depression between the olecranon process of the ulna and the medial epicondyle of the humerus. SI8 is the sedation point of the meridian. This point is used in sedation of small intestine yang. in gastroenteritis, appendicitis, and acute Crohn's disease, and in the sedation of Taiyang, like acute angina pectoris, tachycardia, mania, insomnia. SI9 and SI10, SI9 located with the arm abducted, one tune superior to the posterior axillary fold on the lower border of the deltoid muscle. SI10 with the arm adducted on an imaginary line extending in a superior direction from the posterior axillary fold on the lower border of the scapular spine. Common pain points. SI9 and SI10 are common pain points in posterior shoulder pain. Often, patients complain of pain and tingling down the arm when sitting back and causing pressure to this area. As the pain travels down the meridian to the medial side of the arm, if this is on the left side, it may be misinterpreted as angina pectoris. SI12 is located in the center of the suprascapular fossa. This is an important point for the shoulder arm area. It is a wind eliminating point for the shoulder and arm. So this can be used in wind diseases such as wandering pains, pruritus, and chill pains after exposure to wind. It should be needled to the shoulder with the wind elimination needle technique. SI17 is located posterior to the mandibular angle on the anterior border of the sternocleidomastoid muscle. SI17 is used as a local point for the pharynx and larynx, for tonsillitis, pharyngitis, and hoarseness of the voice. It is a good point for acupuncture anesthesia for tonsillectomy. SI19 is located anterior to the ear at the level of the middle of the tragus, in a depression between the tragus and condyloid process of the mandible. It is usually given with the mouth open. SI19 is the last and exit point of the SI channel before it connects to the urinary bladder meridian at point bladder 1 at the eye. It is used as a local point for the ear and the mandibular joint, for tinnitus, deafness, and blocked ear.